We have currently over 800 soldiers and airmen performing a duty in North Carolina. It's important for us to medically screen them because we want healthy soldiers going out into the field supporting the citizens of North Carolina. So we've identified that there are higher risks for severe illnesses, and we want to protect not only our soldiers but protect the community before we send soldiers out to the field. So obviously this is a medical event responding to the COVID pandemic, and because it's a medical event, intrinsically the medical forces we have are the first responders, are the frontline troops, and we're serving the community as well as serving the soldiers, and this is why it's important for us to participate in this event. So mid-January we started our response plans and preparedness for this pandemic event. The way we did that was communication to the field in terms of hygiene, frequent hand washing, some just common public health measures that really wasn't advertised that much to the civilian population yet, but we took the lead. And communicated that to our troops, our soldiers, and as the event has progressed, we've been taking the forefront and lead in preparing our soldiers, communicating to them requirements and safety measures, not only for them but for their families, and something that they can relate to the community as well. So in terms of daily operations, we have to treat this as a deployment. We have to take care of soldiers. Soldiers will get sick, soldiers will get hurt, and our goal is to provide Role 1 medical treatment. Role 1 really is urgent care medicine, what the civilian community defines as urgent care medicine. One of the main reasons we're bringing on field medical support is to relieve the civilian medical facilities support for our soldiers. You know, if we can take care of our own, we will take care of our own, and we'll leave the civilian hospitals to take care of the civilian population, those higher acuity kind of patients, the ones that need respirators and ventilators. We're not going to inundate emergency rooms and primary care doctors' offices and urgent care facilities with soldiers, minor complaints that we can take care of. And soldiers are going to be hurt. Soldiers are going to be experiencing injuries and illnesses like ankle sprains or low back pain and rashes and common maladies that every soldier then during any deployment goes through. And the main goal is to just relieve that burden off the civilian medical facilities. The North Carolina National Guard, we've been asked to staff a alternate care site. Specifically, we're going to be treating a civilian population, low acuity patients. There's two main reasons where we are participating in this event. The first reason is we want to relieve the burden off larger hospital centers like the Dukes, the Wake Forest, the Wake Baptist centers, and this is where our low acuity patients will go to in terms of discharge or needing further follow-up care. North Carolina Emergency Management has requested us to staff an alternate care site with approximately 61 North Carolina National Guard medical personnel. This is a unique operation because we will be treating a civilian population. We will be on an authorized military duty status. It does present challenges. However, the benefits are great for the community, for relieving the burden off civilian providers and larger civilian hospital systems.